Very good afternoon, everyone. Before I start, I would like to have some question with you. So, how many of you still carry some of your health record whenever you go to hospital? I think almost all of us. How many of you or your like family members have chronic disease like BP, sugar, diabetes? I think almost all of us are having the same members. And how many of you have played PUBG, but till now you have not utilized that technology for your study or for the healthcare things? How many of you have went to hospital uh, for any checkup without any symptoms? I think none of us. None. Okay. Yeah. Some of them are careful, so they are going. So generally, we don't go to the hospital if we don't have any such symptoms. So asking this question, the point was this: like we are still facing healthcare access in not just in India, not just in tier 2 city, all over the India, all over the globe, we are still facing healthcare accessibility. When we say that the future of health is digital, and when we say the future of health is digital, to implement it or to make it possible, we need resources and collaboration. But when it comes to the part of resources, we are lacking. We are lacking hugely. Like there's a huge shortage of doctors and healthcare workers. According to the NITI Aayog to 2019 report, there is 6 lakhs of doctors, 6 lakhs doctors we are lacking, 2 millions of healthcare workers, nurses and staffs we are lacking even only in tier 2 city. I'm not even talking about the whole India. Just in tier 2, tier 3 cities, we are facing shortage of 6 lakhs doctors to more than 2 millions of doctors. Every passing day, we are we as a youth, we as an adult, every passing day, the rate of chronic disease in adults is increasing. Like 40% right now, tier 2 city is in such situation that 40% youth is covered with the chronic disease condition, stress, hypertension, BP, sugar, diabetes. So these are the situation, these are the scenario which we as a youth also we are facing. So, but what's the, like, we are facing these all things, but do we have such doctors? According to the WHO says that in tier 2 cities, the patient to doctor ratio is only 1 ratio 1500, which is too far from the standard one. So what is the solution for these all things? We all know, we all are from India, we all are from tier 2 city, or we all are facing such type of daily things. So what is the solution? So there can be many solutions. Their government is working very hard, but there can be one very simple solution, and that can be I can say community driven health kiosk. So what this kiosk mean? A kiosk can be a setup, a kiosk can be your mobile, a kiosk can be a room, a kiosk can be anything which can contain your health analysis machine or devices. So this, what we can do, are we in a stage that we can go hospital every day to get ourselves checkup? Of course not. We cannot go because we don't have that much resources or staffs who can check or who can provide their services to us every day. So what we can propose, like we are right now going to ATM and we are retrieving money. We don't, right now we don't need any assistance to retrieve our own money. Similarly, we can have such setups in nearby our localities where we can go and we can self-examine ourselves. That is very important for Tier 2 cities, okay, you might be thinking, okay, I'm having my mobile, I'm having so many things, I can check in my app, but I'm talking about those people who are not, who don't have accessibility of those things. So for those, we can provide this community driven health kiosk system, or you can say the health ATM things, by which where they can go and they can analyze their health. At least they can do the preventive screenings. So what is the idea? Idea is we need not to make tier 2 city or convert into the tier 1 city, but the idea is, or the goal is, to convert the tier 2 city into the global icons. So we have to take such type of steps. So while we are implementing health ATM or such community driven health kiosk, the idea is good, but main problem is the implementation. Until and unless any idea is not implemented properly, it is the fail thing. So implementation is important, awareness is important. We have to make people aware that your preventive screening is important. There is a huge possibility that your parent may not transfer you the property and paisa to you, but there is a huge possibility that they can transfer disease to you. So preventive screening is very important. There's a huge chance that they cannot transfer a property and paisa to you, but you have to be sensible enough that you have to do preventive screening. For those preventive screening, we can put those health kiosks nearby our locality within 2 kilometers of radius, so that any individual can go and check. Any person, like whether it's poor person, because health is not just a privileged thing, it is not a right. Just like we are breathing, just like we are taking food every day, we should take our health analysis thing in that serious ways, that will help us to not tend to the cancer hub or diabetic hub which we are going to attend. So what we can do, we are having mobiles, some of the people also having some of the thing, why people will go to the kiosk. So to make it a thing worthy, what we can do mandatory thing, like we can ask doctor to mandate their 1 or 2 hours weekly, or in a day or a week, they can provide 1 hour of consultation, and that kiosk can be used at a point of conversation between patient, rural patient, and that hospital or a doctor. So they can do conversation and telemedicine thing. We can implement this kiosk anywhere where the crowd is. Like if you are going to temple, you get the prasad, you can get your health analysis checkup also. Right now you are here, we all are gathered here, we can have a kiosk here, we can utilize that kiosk for our health analysis. So implementation is important. We have to think where we have to put that kiosk, and that kiosk can be used for multiple purpose once it is installed anywhere, like for women's safety, for post hospital care, because most of the people are not aware about the thing what I have to do once I have discharged from the hospital. If my wife has been discharged from delivery, what I have to do, because there is no such guidance, what I have to do with my wound. So this type of information also it can carry, it can be the storage for our own medical history. So if a person is here, like I am here, I am from a different state, but I am here, I am not with my medical records, I can go to that hospital, I can go to kiosk, and I can retrieve my own medical history if required. So this is the thing which we can do. So problems are a lot, we have to come with some of the solutions. So we have to involve ourselves in such innovative way that a community can heal, and we can not just uplift ourselves, and we can uplift the whole society as well.